and welcome to the School of Health Professions Facebook page, where we're going to learn about occupational therapy. My name is Sherry Gann. I'm the recruitment coordinator for the School of Health Professions at Mizzou. And joining me today are 3 students in the School of Health Professions, one who is in the occupational therapy graduate program, and 2 more who hope to start soon. So let's meet our students today. Joining me are student ambassadors Amelia Benini. Amelia, how are you?
I'm good, how are you?
Good. Bailey Bremser. Bailey, how are you today?
Pretty good.
Good. And we have Paige Headley. And Paige, you are currently in the OT programs, right? And Bailey will start this summer.
Yes.
And Amelia maybe next year? All right, very good. So the first thing that I want to talk about, I have some questions that were sent in by various viewers of our Facebook page. So the first thing they want to know is if they want to go to occupational therapy school, and that's a master's degree here at Mizzou, what is the best undergraduate degree? So why don't we start with Bailey and Amelia, since you are currently undergraduate students. Would you like to each also tell a little bit about yourselves, year you are? Let's do that first, and then come back and answer that question.
Okay. I'm a junior health science major from Chicago, so I'm looking to go into the OT program, apply next year.
I'm from Des Moines, Iowa, and I'm a senior health science major, and like Sherry mentioned, I'll be starting the OT program here at Mizzou in the summer.
I'm Paige, and I'm from Nixon, Missouri, and I'm a second year in the program right now.
All right, so back to our question.
So Amelia and I are both health science majors. We're using that to get to OT school because a lot of the prerequisites for OT programs, both at Mizzou and around the state, align very well with the core requirements for the health science degree.
It's an awesome degree. It's really flexible and has a lot of classes that get you acclimated with patient care as well.
So what emphasis area should they do if they are a student who wants to go into an OT program? We have emphasis areas for the health science degree, 4 emphasis areas. Which one would be a better fit?
So most of us will do the rehab science emphasis area. That adds extra classes to your health science degree that kind of gives schools the idea that you were looking into a rehabilitative science route when you were an undergrad.
Okay. Paige, I have a question that is a perfect one for you. What is the difference between OT and PT, physical therapy?
All right, so physical therapy is going to be looking more at like gross motor, gross movements, and occupational therapy. Our main focus is getting people back into occupations, which we just define as meaningful activities. So that may be looking at your mobility, that may be adapting your environment, that may be getting you assistive technology, those things like that, just to help you engage in your occupations again.
And you can work with any age person, correct?
Yep, we work from babies in the NICU all the way up to geriatrics and in lots of different settings as well.
So give me some examples of what an occupational therapist working with those teeny tiny babies in a NICU might do, what an occupational therapist working with, say, an 8-year-old child might do, and an occupational therapist working with a middle-aged adult.
Okay, so in the NICU we might be focused on positioning or sensory stimuli. So the babies came out early, so in the womb they wouldn't have a lot of stimulation, so we might be trying to decrease the stimulation or position them in an appropriate way for feedings. An 8-year-old, maybe they have a disability that limits their fine motor skills, so they have a difficult time getting dressed, so we might be working on zipping their jacket. Did you say geriatrics? Mm-hmm. So we could be working on transfers into the shower when maybe they have decreased strength or decreased mobility. They can't step over the shower anymore, so we might be working on a transfer, which is an alternative way to get into the shower.
Okay, great. So if you're an undergraduate student, and we'll say a lot of the students who will be watching this may be high school students who want to become undergraduate students, what are some good classes for them to take that are maybe in addition to what would be in the health science major?
So both Bailey and I took a class called Intro to
Recreation for Individuals with Disabilities.
There you go. And so that class focused on different disabilities and the ADA and working with people out in the community doing recreational activities what's available to people who use wheelchairs, what's available to people who are blind. So that really kind of acclimates students with the whole disability community that's out there, which really gives you a leg up when going into OT school.
I took classes on ABA and autism, which is applied behavioral analysis, and it focused on behavior modification for especially kiddos with autism. It was really cool. I hope to work with pediatric patients in the future, so that was an amazing class to take.
Paige, one of the things that I know applications require for OT schools would be volunteer and service hours. First of all, why is that important? And what are some types of volunteer or service activities that a student might do to prepare them for OT school?
Yeah, so volunteering is important because it shows that you're invested in the populations that we might work with, and it gives you an opportunity to get to know them. So any volunteer opportunity where you're working with individuals that may have a disability or maybe marginalized would be great. It shows that you're committed to learning about the populations.
What kinds of volunteer activities do you ladies do?
So we're involved in a club called POTO, which is a Pre-OT Student Association on campus. Through that club, we do two main service events. One is Paquin Towers, which is a living facility for people with mental and physical disabilities that are very low income here in Columbia. And we love going there. We do bingo, we have game nights, food and prizes, things like that. It's so much fun. And we also volunteer at a Down syndrome support group meeting, and we take care of all the kiddos while their parents attend the support group. So fun for us, fun for the kiddos, organized chaos, but yeah.
And another service organization that I'm a part of is called Mizzou Alternative Breaks. So that's a student-led organization that sends out trips of 12 students focused on different service focuses. I've done disabilities all 3 years, OT, very related. And so my favorite trip I went on was an adaptive ski trip, working with people with disabilities, learning how to ski.
So what's a cool thing about volunteering besides getting you ready for programs? Do you just volunteer with all the same people you know? Do you get sometimes thrown in with people you've never met? What kinds of advantages are there to volunteering?
So I'm actually involved in an American Sign Language class, and during one of my volunteering opportunities, I got the chance to sign with an individual who was deaf at that event, which was a really cool experience for me to apply the classroom in a real life setting, so that was really awesome.
A lot of times through volunteering, you can meet people that might not necessarily be in your classes or that you see on a daily basis. So you meet a lot of people, you get a lot of experience with potential employers, things like that. That's very valuable during your undergraduate years.
So Paige, what are some important things that students can look for in shadowing? That's the other key on your application. Of course, in addition to having your solid grades and taking the right classes. Tell us a little bit about shadowing, what it is, how to get that. Can they start it now as high school students?
Yeah, so we require that students have 20 hours of job shadowing with a licensed occupational therapist in at least 2 different settings. So we require 2 different settings because it's important to see what OT looks like in various settings. It's not going to be the same everywhere you go, and it's okay to have more than 2 settings. It just gives you an opportunity to see what OT looks like, because for me, I job shadowed and I saw OT, but being in the program, I've seen OT in a whole different light, and that it's so much broader than I thought it would be. So it's just important to get to see all the different opportunities that you could have as an occupational therapist.
Now, the occupational therapy program at Mizzou is a master's program. So I've been talking about high school students because we have a lot of high school students who will watch this, who want to come to Mizzou. But we may also have people who are already established in other careers, or people who are college students anywhere who could be watching this. What are some things that they can do to also prepare for a career as an occupational therapist? And any of you can jump in on this as well. We'll start with Paige.
I would definitely say high school students can start now job shadowing. It's never too early to start, and the later you wait, the harder it is to get in with clinics, because especially in our area, everybody's kind of inundated with students wanting to job shadow. So the earlier you do it, the better, and the more likely you'll be able to get all your hours in.
What about those people who don't fit the high school student mold? And can they shadow? Is that hard for them to get to do other than juggling their own work schedules?
Yeah, it just depends on where you want to shadow. So I just called a bunch of clinics and hospitals and asked if I could shadow. There's really no age requirement besides that you probably need to be a certain age, but you're not too old to shadow, and they'll probably be flexible with your work hours as well.
Where have you all shadowed?
I did lots of my shadowing at home. The winter breaks and Thanksgiving breaks are the perfect times to shadow because obviously back home in Des Moines, it's not a university town, so there's much fewer students that are looking for those job shadowing hours, so it's easier to get into clinics. I would say just put your feelers out, at Christmas, talk with your relatives that you're interested in OT. You'll be surprised where those connections come from.
I'm from Chicago, so Athletico, I'm sure people from there have heard. I shadowed a hand therapist when I was in high school, and that was an awesome experience just to follow him around and see all the different types of patients he saw on a day-to-day basis.
Now that's interesting, a hand therapist. So that means there are a lot of specialties in
Yes.
OT. Paige, talk to us about some of the specialty areas.
Yeah, so there's hand therapy, like she mentioned. People can specialize in mental health. Our program specifically just prepares you to be a general OT, but you get lots of experience in different specialty areas. So there's field works where you can be with a hand therapist or work with pediatrics or work with adults. There's lots of different areas that you can see, but you will be a general OT when you come out.
Do each of you have a specialty area that you're particularly interested in? We'll start with Amelia and go back down.
I've really found through the health science degree that my passion is people with disabilities, specifically people with Down syndrome or autism, so I'd love to kind of specialize in that area of OT.
I love working with kiddos, but spinal cord injuries are also super fascinating to me.
I thought I loved working with kids, and I still do, but I also really enjoyed my adult class this past semester, so I'm really interested in seeing where that takes me as well.
Now, once we get into the OT program at Mizzou, you, Paige, actually have patients that you work with, right? Or clients, we call them. Can you tell us a little bit about some types of clients that you've worked with? We know, of course, we have to be careful to not divulge specific information.
Yeah, so we have lots of different practicum opportunities. So each student will get to be with a client, and they're under the supervision of their professor. And so we have an adult clinic that's a pro bono clinic on campus, and we also have a pediatric clinic. We also do home health visits. We have a life skills group for kids with autism. We have a picky eaters group for kids with autism. So lots of different individuals that we can work with.
So the key thing for anyone watching this program is that they want to get into OT school. So what are some of the most important things that a student can do to make sure they're a strong applicant? So we'll start with Paige because she's in, and then we'll come to Bailey because she knows she's going to be in, and then Amelia, things that you're working on because you want to be in. All right?
So we look at students and to see if they're well-rounded students. So yeah, it's important to have a high GPA, but it's also important to have other things that we look at. So we look at 4 things, and it's your GPA, your resume, your interview, and your essay. So if you're strong in one area but not so strong in the others, you should try to improve those areas so that you're very well-rounded.
So we, obviously the minimum number of job shadowing hours you need to apply to Mizzou's program is 20, but the more job shadowing hours you have and the more volunteer experiences you have, the more things you'll have to pull on for an interview. So I found that I went way over those minimum requirements because I wanted to have more and more experiences that were different and diverse to talk about in an interview.
I'm always looking for ways to set myself apart in the application process. So I opted for a minor in Spanish and then also getting acclimated with American Sign Language, which I really think will help me in my application process because it opens me up to more populations that I could work with as an OT.
Oh, that's a good strategy. So Paige mentioned that if you have an area that you're not as strong and maybe need some help, to concentrate on that and make sure you bring that up. So what are some different supports that we offer here at Mizzou and specifically in the School of Health Professions to help students prepare? Anyone can jump on.
Well, our advisor staff here in the School of Health Professions is amazing. They are a support that's not your parent, but also has enough care for you to kind of make sure you're doing okay in college. You can go to them for class advice or just advice about getting acclimated to Mizzou, so they're a really great resource to have.
That sounds good, Bailey.
We have a student service center for the entire campus across from Ellis Library. They do tutoring for those like hard, very challenging science classes, anatomy, physiology, things like that. And they also offer writing support, writing center, and that can be very helpful for editing papers and things like that.
I was more nervous about my interview, so I definitely took advantage of the SHP Career Services and did mock interviews and had them review my essay, and that was really helpful.
And all of these services, there is no extra charge, is that right, students?
Yes.
Which I think is a wonderful thing because you pay for it essentially with your tuition, so take advantage because these are professionals who help you. You know what I always say about the advisors? They're the grown-up here who's not related to you, who's got your back. And that's important, right?
Definitely.
What are things that your advisors, so I'm going to go specifically here, Bailey first and then Amelia, your advisors have helped you with as you prepare to be applicants for the OT program?
So your advisors learn a lot about you very fast. They pick up on your learning style, what classes you succeed in, and what classes are a little more challenging for you. So they can tell you and give you advice on what professor to take classes with. Sometimes a different professor can be the difference between an A and a B, and when you're looking for that high GPA, that's very important.
They are also really good at kind of moving your schedule around. So as a freshman or someone who's not as familiar with classes at Mizzou, they'll kind of tell you which classes play well together. So taking anatomy and physiology in the same semester is probably not the best choice. So they'll kind of flag that down if you've made that.
Okay. So Paige, I'd like to ask you, once a student gets in the OT program, tell us about 3 classes that you have had that you love, or maybe it's one that's coming up that you're excited about. Why? What you learned in those classes and why you really love them.
Okay, well, our curriculum's changed. I'm the last year that's doing the curriculum that I'm in, so it's going to be a little different for the new students. But I'm definitely enjoying my clinic practicum because I'm able to apply what I've been learning in the classroom. I also really enjoyed my adult class because our professor tried a new way of teaching this semester. She did some research, and so we got to be a part of that, and it was really beneficial to all of us, and I learned a ton in that class, so I really enjoyed that, and that'll still be in the curriculum. Another class would be, our foundations class. It sounds really boring, and it probably wasn't like the best class that we've taken, but it really does give you a foundation and help you understand what OT is and broaden your horizon for what you could do and understand the theory behind all of our interventions.
Very good, thank you. So Bailey and Amelia, you're both undergraduate students. What has been, I'd like for each of you to name one class in your health science degree that you think has been really good and is going to be very helpful to you as an OT. Bailey, we'll start.
I think my favorite class as an undergrad was clinical ethics. It teaches you a lot about those tricky situations you'll be put in as a healthcare provider. And nothing's black and white. There's a lot of gray area in healthcare. And it was a super interesting class that really challenged you to think a little outside the box.
A really helpful class that I took was healthcare in the U.S. While it's not super exciting, it's definitely important. It focuses on Medicare and Medicaid programs and kind of the status of the health policy in the United States right now, which is a really important information to be a well-rounded healthcare professional. So it was helpful.
Now, I know that professional development is incredibly important for our undergrad students and for our graduate level students. So Paige, in the OT program, how do your faculty work with you? In some respects, they treat you a little bit like colleagues already and involve you in their organizations. So how does that work, and what is that like for you as a student to have that opportunity?
Yeah, so we actually have a professional development course to start the program, so you kind of get an idea of what your professors are going to expect of you, what your future employers might expect of you. There's high expectations in the program, so that improves our professional development skills because you're going to have high expectations when you're out on the job. So when they don't let you get by with little things in school, that's because later on down the road, you're not going to be able to get by with little things like that out in your job.
And do you get to go to conferences with them?
Yeah, we do. So this year I get to go to the AOTA conference, which AOTA is our national organization for occupational therapy. So we get to join them in that and go to the same sessions that they go to, so that's really neat.
When do you start, you mentioned the clinic, the Tiger OT clinics here. When do you start doing actual field work away from your professors watching you?
Yeah, so we have two types of fieldworks. We have level 1 and level 2. Level 1 are going to be closer to Columbia. You're not necessarily working with an OT, but you're working with the populations that you might work with. And then your level 2 is your last semester of the program. They're 2 12-week fieldworks, and those are anywhere in the United States. So you're not with your professors anymore, and you have a clinical supervisor who's working there. So you'll do that your last semester of the program.
Have you started thinking about that?
Yes, we're preferencing them right now.
Are you?
Yes.
So this is an exciting time.
Yes, yes.
Bailey, now that you're admitted and you're getting ready to start the OT program this summer, what are you most excited about and what might you be nervous about?
Like they've been mentioning already, I'm excited to work with patients hands-on during the program. I think that's really beneficial at Mizzou's program because you'll walk out into your job and have experience with patients, your own patients. I'm definitely nervous about the course load in general. It's a lot more intense than an undergraduate degree, and that is a little nerve-wracking.
It is a little nerve-wracking, but I think you'll do just fine. All right, I'm going to start with Amelia. I'm going to ask, I've messed up your name, Amelia. I'm going to ask each of you the same question, so I'll lay it out here. I want to know why each of you chose Mizzou and why you chose Mizzou for your occupational therapy education. So we're going to start with Amelia.
I chose Mizzou because the School of Health Professions has so many opportunities to get involved with the community that OTs work with, and it's also a healthcare campus, so there's Boone County Hospital, Women's and Children's, the university, all within probably a 10-minute radius of the campus, so there's so many opportunities through those as well to work with populations that will need OTs.
And of course, Boone is not affiliated with the university, but we do have 5 hospitals here on campus affiliated and owned by MU Healthcare, and that's a wonderful way to get to shadow and get those experiences. Thank you, Bailey.
I chose to get my undergraduate degree at Mizzou because there is an OT program here. I was able to interact with a lot of the students and faculty in the OT program. So going into my interview, knew a lot of the professors and a lot of the students. I could, interact with them and ask them questions, pick their brains about the program. And I thought that was really beneficial as an undergraduate looking to go into OT.
Paige.
I chose Mizzou because I wasn't really sure what I wanted to do, but I knew I wanted to do healthcare, and like Amelia mentioned, we have great healthcare programs. And then I chose Mizzou's OT program because of the hands-on experience. Other programs don't always have the pro bono clinics that we have, so that's an additional opportunity to get your hands-on clients and learn what you've learned in the classroom and apply it to an actual situation before you're out on field works.
And the thing that you will have coming up after you finish your classes is that test, the licensure test, and getting a job. So what do you know about students from Mizzou OT with relation to those two activities?
Yeah, so we have a 100% pass rate for first and second time test takers. So the majority of our students pass the first time. Occasionally we'll have a student who doesn't pass the first time. Maybe they had a bad day, they're not a great test taker, something happened on the test day, but all of them have passed the second time if they didn't pass the first time. And then we also have 100% job placement. So that's really encouraging for me as I'm about to head that way.
Absolutely right. Ladies, thank you so much. And thank you for checking out our OT experience here at Mizzou. We'd love to have you be a Mizzou Occupational Therapy Tiger.